Hello everyone, I am going to share a good news with all of you this time. So we all know that angioplasty is lifesaver. In situations like heart attack, we do an angiogram and then we see the blockage and then finally we do angioplasty. And in the process of an angiogram and angioplasty, we push contrast into the coronary arteries, which tells us where is the blockage, how is the blockage, and then finally we fix it. So the patient is saved by putting a stent. His heart attack, gets treated. But in some of the patients, this contrast which we push can lead to kidney injury. Usually the patients with normal renal functions, they go unaffected. But sometimes with patients who are having mild renal dysfunction or severe renal dysfunction, their renal dysfunction progresses and they may land up with chronic dialysis, what we call chronic kidney injury. But nowadays we have a solution for that. Even in situations like coronary artery angioplasty, we have a device called intravenous ultrasound or intravascular ultrasound, IVUS. And with this IVUS, we can exactly see how much length of the stent is required, what kind of blockage is this, does this blockage has a calcium, how is it the thrombus load, everything, every minute thing which can be made out with intravascular ultrasound. And then finally, after putting the stent, we can see with intravascular ultrasound that stent has been apposed properly or not, it has reached the desired place or not. He's a middle-aged gentleman. He came with a heart attack, and when we did an angiogram within window period, we found that his right coronary artery was 100% blocked, and left coronary artery had a 90% disease. So as a rule, when someone has heart attack, we treat only the vessel which is 100% blocked. So we did the right coronary artery angioplasty and sent him back with a plan to do a left-sided angioplasty after 1 month. Since his creatinine was normal, renal function was normal before the first angiogram angioplasty, after 1 month we did not foresee any problem. But just as a checkup, as a routine, as a protocol, we did an urea and creatinine, and to our surprise it was high. It was something like 2.2, elevated. So this patient who had a normal function, kidney function, had developed contrast-induced nephropathy because of the life-saving procedure. Then we waited for this injury to settle down. We waited again further 2 weeks, and then his creatinine came down to normal, and this time we used intravascular ultrasound to guide angioplasty to his left artery.